Good morning again, everyone. We're really glad that you're here to learn a little bit about self-care and managing yourselves and your practices in an optimal way. I'd like to take just a moment to make a brief announcement before we introduce Dr. Tetlow. I want to remind everybody that we will have a Q&A session after her presentation. The way that we take questions for the Q&A is through the IFM program app. So if you haven't already downloaded that onto your phone or other mobile device, I want to encourage you to do so. When you open up the app, at the bottom there's a tab that says Q&A and polling. Click on that tab, then you scroll down to this particular session. Once you open up the session, you'll see in the top right corner there's a plus symbol that says Ask. So you just press on that so that you can enter and type in a question. You also have the opportunity in the left column to upvote questions that other people have posed. So if someone has posed a question in which you too would like to hear the answer, you can upvote it and it moves it further up the list. And so we do look at which questions are more popular and that more people are interested in hearing the answer to. Alrighty, so I'd like to introduce Dr. Tetlow. So Dr. Georgia Tetlow, she is a certified IFM practitioner. She founded Philadelphia Integrative Medicine in 2009, a model site for functional medicine application and on-site clinician mentoring. She maintains both a thriving patient care practice and a mentoring practice for clinicians in transition or maintenance phases of functional medicine practice. She is boarded and fellowship trained in integrative medicine and specializes in applied genetics as part of a comprehensive functional medicine approach. She mentors providers to honor self as the key to stress reduction and a thriving practice. Over the past 5 years, she's pioneered a self-care curriculum for practicing physicians or clinicians. She is the recipient of Howard Hughes Medical Grant Funding, a Heller Foundation Grant, the Arnold P. Gold Foundation Leonard Toe 2004 Humanism in Medicine Award, the Brody Award in Medical History, and a 2018 Mainline Today Top Doctor Peer-Reviewed Award. So without much further ado, I'd like to welcome Dr. Georgia Tetlow.
Thank you. Thank you for that kind introduction. I'm delighted to be with you here today, and I'd actually like to get started by sharing my vision. I create my dream of creating empowerment, inspiring change, and creating trust in my patients, my providers, the functional medicine community, and the medical community at large. So I'm actually just going to say that one more time. I create my dream of, it's also creating empowerment, creating transformation, inspiring change, creating trust in my patients, my providers, the functional medicine community, and the medical community at large. So I intend to create an internal experience of safety and of support. Try to inspire that in my patient care. I also try and inspire that and co-facilitate that and assist my providers, the providers that I work with as a coach, and the providers in my office to experience that internally. So I work with physicians and healthcare providers. I'm also intending to create that experience for myself. So I'm creating that experience right now of safety and of freedom. So please join me here. Our talk is called Honor Self, the Key to Provider Stress Reduction and a Thriving Practice. Honor Self is also the name of the type of mentoring that I do by phone with clinicians. I am a healthcare provider, coach, and mentor, in addition to being a full-fledged functional medicine and integrative medicine clinician. I, as you heard, founded Philadelphia Integrative Medicine in 2009, so we're going to have our 10-year anniversary in 2 weeks' time. You're all invited. Maybe take a flight out to Philly and we'll pick you up and We're going to have a lawn party with free acupuncture and free food and lots of good vibes. This is the clinician burnout talk at the international conference, but I'd like to really rework that emphasis. Actually, this is the joy, relaxation, and freedom talk for us as providers. So we're going to shift that, and you're going to feel that shift in the emphasis and also in my approach and what I hope to give to you today. So I'll actually just clarify a little bit about me. In addition to being a provider coach, I'm also have a faculty affiliation at Thomas Jefferson in Philadelphia. Thomas Jefferson also sponsored me for my 2-year Integrative Medicine Fellowship at the University of Arizona. So before I was a physician, I was trained as a yoga teacher and a yoga therapist. I got my certification in Ayurvedic medicine in 1995. And I'm also trained as a mindfulness teacher. And all of those things have prepared me to be a healthier clinician and also to do my work with providers. So one of the things that I've learned in my day-to-day experience as being a business owner and running my clinic and also working so closely with providers in my own clinic and across the country is that I have an opportunity to not just operate from hard competence, but actually to be vulnerable. And this is something that I hope to demonstrate as we go through the talk. There's an opportunity for us not to use our competence as a defense, to show our strengths and not to necessarily show our weaknesses. And I think what's been demonstrated throughout this whole weekend at this international conference is that there's a tremendous amount of vulnerability being shared and offered from the stage for us. And it's such a beautiful thing, and it's a modeling for us to adopt that way of being, to show our strength and our competence through that authentic vulnerability. So one of the very exciting things that I'm going to offer you today is, and I have no financial disclosures, no industry affiliations, one of the very exciting things that I want to address is this ongoing transition that we all find ourselves in, that we're all in different phases of. So we may still be in purely conventional model, and many of us have started to transition to a functional medicine model. So I'm trying to demonstrate with images that we can have pain and challenges kind of at every step of the way, and sometimes we're bringing those challenges with us into the functional medicine model. Where we'd like to go is to this stage over here. This cup is full. And I have done a lot of work on what are the steps and ways to support us, support myself and support the people I work with to actually feel that my cup is full when I first wake up in the morning and throughout the day. So what I have done is, what you'll see in front of you is a handout. We'll be getting to a self-assessment later in the talk. But on the opposite side of your handout, there is a grid. And this grid is really the body of the second half of our talk. And what I'll be going over are all of the differences in this new type of medicine. What's hard, what are the solutions, and what is our potential. So we'll go through this very systematically, step by step. You'll see what is a real issue for you and some of the helpful keys in order for us to discuss this very real transition and hopefully this full transition to your cup is full. So when we're getting to goal, when we're in this process of transitioning, sometimes we're going to experience some shared obstacles, things that we're all going to be a little bit familiar with. So one of those first things is even the concept of charging money for providing medical care. Even if you don't charge money and you haven't figured out what your prices are, or even if you are charging money and you're thinking about, is that the right amount, or should I increase that amount, or is that sustainable for me and my patients? Even the concept of charging money can cause us to feel like this. This can be a trigger, this can be a stressor, and it brings up fears and it brings up issues, and we want to explore that a little bit today. Also, sometimes we've had a plethora of patients, plenty of people flocking to us, and we haven't had an issue with the number of people that are coming for our services. When we transition to a functional model, sometimes this issue comes up. Where are the patients coming from? Are there going to be enough of them? Are they the right types of patients for this type of medicine? We're asked to embrace a whole new set of tools. I know you've just came from the break where there is so much to learn and so much advancing in our field, under our feet. We're embracing new tools in this new medicine. Sometimes we really don't know what we're doing, and we need help. So functional medicine addresses conventional burnout, but it also creates its own type of burnout. Some of the qualities of burnout can be the same, and some of them can be unique and new. We're asked to shift our identity. Our role as a provider in this new medicine is very different from our role in a conventional model. So are we doing it to the patient? Are we fixing the patient? Are we alternatively part of a process and inspiring the patient to be well? So teasing out this identity shift is really important because we're going through it whether or not we name it or not. Financials are very different. We'll touch on that quite a bit today. The logistics, how do I do this? How do I set up a business? Or I've set up my business, and how often do I look at the financials? And do I have the right financial professionals to help me? And do I know what my profit and loss statement is? Do I look at that? How often do I look at that? Do I look at that on a monthly basis? There's a lot of logistics. We're not trained in that. We're trained as healthcare providers. And we're asked to start anew. We have a lot of stability and financial return, and sometimes we come from a place of stability, not always, but we're asked to start again. And this can be a real challenge. So today our agenda will be this. We'll talk about burnout. What is that? What does that feel like for us? How do we know if we're in that, or to what degree and in what way? I will share with you some provider cases. These are two individuals that I have worked with personally, and I'm going to go into a deep discussion of what process did they go through and what did we learn and how did they move through the process to the next stage of their transition towards their cup is full. Those provider cases, those two cases, the first will be a practitioner who's in the beginning and making the transition into functional medicine. The second case is someone who is in established functional medicine practice, and they're experiencing different challenges. So I really chose very intentionally a case for initial transition and then a second case for what comes up for that person in practice. As I mentioned, we're going to be talking about challenges, solutions, and the potential, and we're really going to get into the grid. We're going to look at the details, and you have that to take away with you as a support for you. And finally, we'll do a self-assessment. So that'll be a chance for you to take a look at some key questions. I took a lot of time to choose the questions that I felt will be right for this cohort of providers. I can tell you a little bit about how I formulated that. There's a wonderful professional who has created the Institute for Physician Integration, Dr. Hurley Paolini. And she is a close colleague of mine, and she reminded me to put the sexuality question in the self-assessment. And we really teased out how we word that question. So when we get there, we can also give her a shout out, and so she's contributing and participating in this process of self-assessment. And I invite you to, after we'll do our self-assessment, you'll see where your answers fit with the rest of the group. We're going to do live audience response for a select number of those questions. So you're going to see what are some of the issues that are coming up, and you can answer anonymously and also just see where you fit. That's our agenda for today. So let's dive into the scarier part of the talk, the first half. We're going to be looking into burnout. There's a lot of different words that we can use for burnout. Overwhelm, dehumanization, depersonalization. And I'd like to start with a current traditional definition of burnout. This is a definition from Rothenberger 2017. So physician burnout, and I realize we are not all physicians here, so I like to say healthcare provider or provider. In this case, physician burnout is a syndrome of basically three things. The first is emotional exhaustion. The second depersonalization. And the third, a low sense of personal accomplishment related to our work. So we will go into each of these right now, more in depth, starting with emotional exhaustion. So emotional exhaustion is described when I'm reviewing my 50 medical articles and the latest research to prepare for this talk. There's a lot of equating emotional exhaustion with compassion fatigue. So emotional exhaustion is described in the literature as a deep physical and spiritual experience of exhaustion. Someone described it as being sucked into a vortex that slowly pulls you downward. I think that what we know about compassion fatigue providers, and I can say it for myself with an I statement, is that when we start to get emotionally exhausted, what often we do as providers is we keep going and we push harder until we're absolutely completely tapped out. And that's a very common behavior. As we start to become depleted, we actually just start keep pushing more and keep going. My own experience of emotional exhaustion is, for example, if I've had an emotionally exhausting day, when I come home, I really don't have a lot of emotional bandwidth to hear from my family members. I'm not able to listen and have a conversation and take in much information. I'm in a shutdown mode. I need to take some time for myself. I need to reduce my sensory input and also anything that's asked of me. And it's an experience of being a little bit more emotionally needing to self-protect. The second aspect of burnout is depersonalization. So this is sometimes described as being very disconnected from, you name it, from yourself, from one's body, disconnected from one's job. And as a clinician that invites practicing clinicians to come to our on-site location to do mentoring, approximately 10% of the practicing doctors that come to rotate, shadow, learn, see how we do functional medicine, 10% of those people will describe that during a 12-hour shift, they don't drink water, they don't go to the bathroom, pee or poop, and they don't eat. So that's a high percentage of people. Those are the people that are actually finding the time to come to the mentoring site. So I like to link that experience, that moment-to-moment experience from a clinician, I like to link that to depersonalization, that disconnection from our body and that turning off of those physical inputs from our body and that complete sort of subjugation and focus outside of us on attending to tasks, attending to needs, and attending to our professional role. I also think it's really important for us, and you'll see this will come out through the rest of the talk, is that we are experiencing emotionally charged situations all the time as providers. We are witnessing, we are initiating conversations that are creating a lot of emotionally charged moments. We're participating in creating these moments all the time. And we don't necessarily talk about or have the tools or find a way to integrate some of those serially, emotionally charged moments, and we just keep going. And when we don't have a chance to integrate and process those, there can be an accumulation, and then there can be eventual effect on the organism as a whole. That's us, that's the provider. So we'll be looking at ways to find that moment-to-moment integration, and there's been so many wonderful examples over this weekend with so many workshops. Finally, the third aspect of burnout, and we can feel this type of burnout if you're in conventional medicine or if you're in functional medicine, right? You can be burned out, is a sense of low personal accomplishment. This is so ironic to me because I know how hard I work, and I also know how hard we work as a community. There's a tremendous commitment to our patient care, to each other, and to doing the right thing. And despite a very high work output, and a really impressive work ethic, sometimes we don't actually feel very nourished or that we're receiving or that our cup is full, if you will, at the end. A great way to see whether or not this is an active aspect of burnout for you is to see how you feel when you're driving home. So when you're driving home, just notice the internal dialogue. Sometimes when we're traveling, we might feel that we've really made a difference. We might notice the things that we accomplished and that we feel good about. We might tease out those moments of meaning during the day. That glass feels half full, and we feel good. We feel nourished. Alternatively, sometimes when we're driving home, we're thinking about all those things that we didn't do well, all those things that we missed. Oh, missed that chance to make that gut-brain connection with that patient. Oh, should have brought up pelvic floor physical therapy with that patient. Oh, we start to go through a self-critical internal dialogue. What we missed, what we could have done better. So this is important to notice and to watch and to see where you fit with this aspect. As we do that type of assessment, we're also potentially able to make a shift when we notice. But just noticing is fantastic. So what is happening with burnout? Where does it come from? We love root causes in functional medicine. We like to talk about underlying root issues. One of the issues that I wanted to bring up first is that medical bureaucracy. I use the word bureaucracy very intentionally. That, to me, that word means that we're part of a system that actually has some obstacles to actually the real and meaningful goals and outcomes that we care about. So there's a system, and some of the agenda of that system, some of the dynamics and the way that it's set up and what it's prioritizing, what it's reimbursing, is actually blocking and in contrast to real goals. Goals like good patient care or the provider being healthy. So acknowledging that sometimes we are part of a medical bureaucracy, and this can be at any phase of transition in conventional or functional medicine. It also acknowledges that we are a cog in a system. We're a player in a system, and that system does have its own agenda. Additionally, certainly in a conventional model, we are asked to fix the patient. So what I need you to do is to take these symptoms and to make them less, to make them go away. And that creates its own agenda. It defines the role of the provider, it defines the role of the interaction. It's much more transactional. And there's actually quite a bit of pressure. We hear a lot about no time. Patients share that they don't feel like they have a lot of time in a conventional model. But also providers don't have a lot of time to prepare, to integrate. There's a no time discussion on both sides of the equation. And really above and below, managing up, managing down. No time is probably the most common thing that we use as integrative or functional medicine providers to describe what we do. So when you've got your blog or your social media posts or you're speaking in your live talk, you say, we have time for you in this new model of care. So this is something that we tease out and we explain. This is differentiating from a purely conventional approach. Ego-based relationships. So for me that means relationships that are based on the outer trappings of success. How much money do you make? How much did you do? What's your volume? How many patients did you see? What did you do? And then we get into this feeling like, well, what did I do? How much did I accomplish? And that's an ego-based interaction. So sometimes we have ego-based relationships. Sometimes we have them at home, sometimes we have them at work, sometimes we have them even after we've transitioned into a new model of care. And there's an opportunity also for a different type of currency of value. So at the end of the day, it's not how much did I accomplish in terms of volume and output. It's how did I manage my relationships, my patient relationships, my relationships with my colleagues, my staff relationships. And that's a different way to determine success and outcomes. Often there's a little bit less room for our personal needs. I know when I was in medical training, there was a distinct message to me that the medical system and my attending and the medical team was less interested in knowing my personal experience and also if I needed anything. In fact, I was rewarded when I did not mention my personal needs. I'm still recovering. So what causes conventional burnout? These are some specifics, and again, some of these will continue whether or not you're in conventional or functional practice. Sometimes, and I think we can all relate to this, there's just too much. There's just too much work. There's just too much to do. Work-home interference can apply to any type of job that we have. the work just spills over into the evening, and it spills over into the weekend. And it could be some of this soft stuff. It could be the blog posts and the talks, and it could be an important patient message, or it could be a patient that we're trying to figure out and we're doing extra research on. Low personal autonomy, again, depends on our model. Sometimes we have more or less control over the flow of our work, and we still can have frequent interruptions regardless of the model. Many of these challenges continue even after we transition to another model of care. So I'd like to transition to some scary statistics. So this is a report of 700 physicians. These are symptoms and these are things that I think I have experienced and that many of us in the room have experienced. In this particular group, this study is actually 10 years old, but I chose it because it is very characteristic of what I teased out when I was doing the literature review for this talk. About a third reported excessive anxiety. Almost 2/3 noted exhaustion and stress. And about half suffered with sleep disturbance. Specifically for resident physicians in training, about a third to a half of residents will suffer and actually meet the criteria for depression. And up to 75% or 3/4 actually have and meet the criteria for burnout, the way that we just described it. Those three areas, so emotional exhaustion, depersonalization, and low sense of personal accomplishment, even though they're running the hospital and incredibly busy. And this is a slide just to bring things home. So if you are a physician, you have a 25% increased odds of becoming an alcohol abuser or becoming alcohol dependent. You have a twice or a doubled increased risk of suicidal ideation. So that means thinking about taking your own life or planning to take your life. There are some other scary statistics that have to do with the rate of suicide, and I'll share those with you verbally. That if you're a physician, it's not even the risk of suicide, it's the rate of suicide. So what actually happens? If you're a male physician, you have a 40% increased rate of suicide compared to males in the general population. If you're a female physician, you have a 130% increased rate of suicide compared to females in the general population. There's also an increased risk of motor vehicle crashes and near-miss events. If you're a physician, you have an increased risk. And this is also controlled for fatigue. So taking fatigue out of the equation, you have an increased risk of a motor vehicle crash. As providers, I think something that we do frequently is we suffer in silence. I don't know how many colleagues, or if you have colleagues that have taken their own life. I can say that for the most part, the experience and what I notice is that the clinician doesn't actually express the amount of acute emotional pain that they're experiencing, and that people find out the severity of their situation after they've actually taken their own life. So what we tend to do in many areas, whether or not it's this extreme situation or in other smaller moments, smaller circumstances throughout the day, is as clinicians, we tend to suffer in silence. And we also tend to self-isolate. And we're very good at it. So this is one of the reasons that I have a honor self mentoring program for clinicians. We have, and what we notice is that clinicians like something simple and easy. They like to pick up the phone. So they don't like Zoom, they don't like something complicated. They just want to know that they can talk to you once, or they can have 3 sessions at a time, or they can get a bunch of 3 sessions at a time, and that it's easy. They just set it up, they have a phone call, and they have someone to talk to. They have someone to talk to who is a clinician, someone who understands and is going through similar things or has gone through similar things. Not the same experience, but someone who can relate. It can make the world of difference to have someone to talk to. And it's one of the reasons that we have this program. And then I'm actually a provider coach. And what I do is I listen. I was asked to give a little bit more information about what comes up in Honor Self phone mentoring. And I'll say that what I've noticed comes up with clinicians is they'll talk about their relationships and they'll say, I have an unhealthy relationship. And actually leaving an unhealthy relationship is one of the best ways to get to your cup is full, whether or not that happens to be a personal relationship. And I could say that that is true from my own experience. Leaving a personal unhealthy relationship was my breakthrough to be able to actually feel more joy, more relaxation, and more wholeness, and more health. Other things that come up have to do with the relationship with alcohol, substances, and assisting people to get the help that they need. I'm not a therapist, I'm a provider coach. And other, of course, things like health goals, eating, or what we're eating, how we're eating, sleeping, quality of sleep. Whether or not we're isolating and have people to talk to and creating those relationships in the community and with our loved ones, talking with our loved ones. Creating a primary relationship that is healthy in your life. This is something that many providers have wanted to talk about in mentoring. Establishing an exercise practice that's self-generating, that's coming from the provider. I'd really like to create something that I know is healthy for me that I haven't been able to do yet. Can you help me? I want to know how to, I want to talk through my first step. Also, many want to discuss a way to have a mind-body practice that's doable, that's the right amount of time, the right type of practice for them. It can be mindful walking, it can be Qigong, Tai Chi, it could be Nia like we had this morning. And they're wanting to find a way to create that sustainable, ongoing, consistent practice for themselves. And they might have had it, but they're trying to reclaim it or trying to start it for the first time. And that can make such a huge difference to start to generate help from within. Many of my providers are learning how to ask for help, and then once they ask for help, learning how to receive help. So that's a great practice, and it's a beautiful thing to see as it unfolds. It makes me the most happy of all the things that I do. So when I review the conventional literature, most articles say that there is little known about how to increase provider satisfaction and enjoyment. I will share with you everything that I've gleaned from the literature, that is what we do know and what is suggested. And I actually think that intuitively do know a lot of the things that would help us increase our enjoyment and satisfaction. So I would challenge that, that statement and phrase that I read over and over again. We do know. We do know how to increase our quality of life. One of the first keys that is in the medical literature, very helpful, it talks about the particular role of a self-care workshop and when this could be helpful for us. So specifically, if you have depersonalization, this is something that you might be noticing about how you're relating to your body and your bodily needs, or how you're feeling on the way home from work. If you have depersonalization, you're not feeling human and feeling connected to others and yourself. A self-care workshop has been shown to be a great choice to address depersonalization. I'd like to describe an experience that I had myself. I mentioned Dr. Hurdley Paolini, Institute for Physician Integration. I didn't know that Hurdley was a woman, so when I first came to the workshop and I realized that Hurdley was, Dr. Paolini was a female colleague, she set up a workshop in coastal Alaska where we did tandem kayaks for a physician retreat. It was cold, it was wet. We carried the food in on the kayaks. We set up the tents. It rained on us all night long. I had roommates on either side in the wet tent that snored. We shared equipment. We shared clothes. And she read us poems during the sessions. And she guided us in these personal inquiries. And it was the most moving and humanizing experience I had had in a long time. And it really opened me up. And it brought me back into my body. And a self-care workshop is a great thing to consider. So what I have done is I put flyers for Dr. Paolini's next workshop. And they're on that little table over there where the water is in the back, and there's some outside. And she is she always leads programs that she describes as physician leadership for transformative change. The next one is in September on Whidbey Island off Seattle. And she states, "Our best hope for an improved healthcare system lies in developing authentic, compassionate, and competent physician leaders who create conditions for an alternative future." And she does that. She says, "Increase your capacity for dealing with difficult problems." I guarantee if you go to one of these retreats, you will increase your capacity. "Strengthen your ability to create change while nurturing your well-being." And Dr. Paolini has figured out how to do these with CME credit. Okay? Kudos to her. 25 AMA Category 1 CME for going to Whidbey Island with Dr. Paolini. Another specific intervention that can be very helpful for a type of burnout that I want to tease out is mindfulness interventions. Mindfulness is something very close to me. As a third-year resident, I took an 8-week mindfulness class. And I fit it in. I didn't have a lot of extra time. And I was so moved by it that as soon as I was done with the 8-week class, I signed up for another 8-week class so I could practice. And mindfulness has been a big part of my career in mindfulness in integrative and functional medicine. So I used to teach 4 8-week classes a year in my first job after residency. My first position was medical director of integrative medicine at a large network in Pennsylvania. And I did a little bit of personal burnout, teaching a lot of 8-week mindfulness classes. And it also helped me for those clinicians that work in institutions, right? So I worked in an institution. I was a medical director of integrative medicine. I tried to bring in the new model of new medicine into the institution. So it helped me prepare me for my work later. And on Monday, so day after tomorrow, June 3rd, as part of my faculty role every year, as part of the chronic pain rotation for the third-year students at Jefferson, I teach the medical evidence for mindfulness. And we'll be doing that think of me from 8 to 12 Eastern Time on Monday. Mindfulness is an incredibly helpful tool to help us tolerate and to be with our own experience and to deepen our resilience and our ability to be present, not just with others, but with ourselves, and also to know what our needs are. So there is some written about that. I can say that most of the research that I reviewed for mindfulness had to do with effects and benefits for residents. So research is definitely needed for practicing clinicians. If you do a mindfulness class, you have some built-in benefits because you're not working when you go to the mindfulness class. You have some built-in downtime. Built-in time when you are listening and talking to other human beings in a personal manner. That's time away from clinic. Those are standalone benefits just for signing up. And what we're learning in mindfulness is learning to stay, not to stay in a dysfunctional situation or learning how to tolerate and be with our own experience, no matter where we are. Another helpful piece that came from my literature review is that when we are healthier as physicians, we're more able to counsel our patients on health-promoting behaviors. So this is an article from the Journal of Royal College of Edinburgh that showed how physicians who are engaging in their own exercise and diet changes actually have patients with better health outcomes. And the theory behind that was because if they are engaging in their own health-promoting behaviors, they're more likely to counsel, and that's how that benefit is being passed on. I have some clinicians that find it really hard to do anything that's good for them, and they're very focused on patient outcomes. So this can be helpful to help inspire some of us as providers to take steps. So, and I wanted to mention a few other additional pieces, which is that another article by Wiener et al. He described very, very simple things that I think is important to name, things that can help us with creating resiliency, helping with our personal integration. Spending time with people you love. So a lot of this is not rocket science, but there's a little list of things that I will mention it to you. The study talked about spending time with people you love, focusing on the religious and spiritual aspect of your life, and actually reading spiritual or religious writings, like reading the Bible, reading the Torah, reading the Quran. If you have depression, getting treated for depression. Leaving an unhealthy relationship, which I can put a little pin in. Going part-time, or working in an academic facility so that you actually have an academic aspect to your work. These are ways that clinicians reported finding more wholeness for themselves. So we've talked a little bit about conventional burnout and how functional medicine can address some of those aspects of burnout, but it can create its own challenges as we make this transition. And I'd like to transition to these cases, which I hope will be very helpful to you. So the first case is a male primary care physician who had been in practice for 14 years. Just changing gears a little bit to sort of get into this story. He was very successful. He was comfortable. He was the breadwinner in the family. He also was intrigued and very much engaged with and a believer of the benefits of functional medicine. He had spent money and time, just like many of us, and started to go through the process, and he had actually achieved his functional medicine certification. He was having a lot of challenges in his insurance reimbursed practice, finding ways to practice functionally. There were challenges with logistics. He didn't know how to get the results and how to show them, integrate them into the EMR. Some of his staff members were very unfamiliar and didn't have a lot of willingness to deal with these results. He didn't have a lot of time to go over results in the shorter appointments. Some of his colleagues lacked openness about what he was doing. And we talked about his challenges. And the first time I asked him, and I said, what's going on? What are the issues? What's making it difficult for you to take the next step in your transition? And the first thing that he said to me was, I'm concerned about the finances and the financial security and the investment. And this is a conversation that evolved. So this is what he said first. Then we talked further, and he said, I really like a lot of things about my primary care practice. I love having these long-term relationships with these families and these patients, and I get to see all the different generations in the family. And I just love these people, and I don't want to let that go. And he said an expression that I hear many times, which is, I love the cradle to grave part of my practice. He talked about being a little bit bored, and so it wasn't as interesting doing purely conventional. But then he said, I love it when I don't have to do anything. I just pick up the chart and I just walk in and I just figure out what to do, and it's just not that complicated, and I just feel comfortable. I feel confident. I feel relaxed, and it just makes me feel like I know what I'm doing. Then he said, I have no idea what I'm doing in this new medicine. I think I know what I'm doing, but sometimes I really wonder. I mean, he described, actually, he didn't use the word, but I proposed a word. He was feeling some terror. He's like, I'm used to being the one who knows all the answers, and they ask me a question, and I answer the question, and we go on to the next topic, and now it's completely different. Now I'm getting questions I don't know the answers to. I'm in situations where I'm over my head. I'm having to use these new tools, and I'm not sure what the right next step is, and it's freaking me out. So I really appreciated having the deeper conversation with him. What this clinician did is he joined an established functional medicine practice. So he started to get very excited that he was going to go into this model where there's other people doing the functional medicine. He was excited but also overwhelmed a little bit because there was a lot for him to learn. He was beginning to really see, oh, I'm right. There is a lot that I'm going to have to adjust to, wrap my head around, get comfortable with. He realized for the first time that he wouldn't have tons and tons of patients, and actually getting patients was going to be another task, figuring that part out. And he said, I'm not feeling very confident. One of his colleagues at his primary care practice said, why are you leaving medicine? And he was really upset by this, and we talked about it. What he did is he continued to work very hard in his primary care practice, and then he had this experience of straddling both worlds. He's working in his primary care, and he's working in the functional practice, and it was getting to be a lot of time and energy to basically wear two hats, have two lives, think two different ways. And it was beginning to interfere with his ability to actually get experience and confidence in the new model. So we talked about this too, and we came to the conclusion that he was having a painful and prolonged transition. So what do you do when someone is in this physical, emotional, and spiritual posture? How do you support yourself? How do you support this person? What do you say? What do you offer? How can I be of assistance to this clinician? One aspect that I have learned is that you really want to love the person where they are. It's just like our patients. It's accepting what they're bringing and accepting who they are and what they are, what they're able to do, and the situation that they've got themselves in, offering that acceptance and allowing them to be where they are. Another opportunity is to interact in such a way where maybe offering some very gentle pushing, but in a way that would actually be doable and that would not in any way cause them, I want them to be successful. I want them to be able to make a transition. So, how do you push and offer a few things without being pushy and without pushing someone beyond their level of readiness? So what we discussed and what he eventually came to was the solution to his problem would be that he would need to make the commitment and actually transition and be in practice so he could get the experience and actually see the results. And this was absolutely terrifying for him. So what he needed to do was work with his terror and also work with his identity and work with this very profound shift, which was that I really know what I'm doing and I'm comfortable, and now I'm kind of letting that go and letting that part of me and that way of being go. So this is what the opportunity was. How do you go from the small fishbowl to the large fishbowl? What he had shared with me is that, this small fishbowl, it's actually, I know it's a little uncomfortable because that's why I got involved with all this functional medicine, but it's actually comfortable. It's uncomfortable, but it's also comfortable. So how do we self-propel? We are the goldfish. You are the goldfish. I am the goldfish. How do you self-propel so that you can actually get enough momentum to actually leap out of the small fishbowl into the large fishbowl? So how do we do that? I think one of the things that I've learned is that you start to develop the practices in the day-to-day so that you start to humanize yourself and basically increase your health on every level, your spiritual health, your emotional health, your physical health. And also you develop those connections with other people so that you can start to get that internal momentum. We need one-on-one support sometimes to be able to make this leap. The way he did it was he addressed his fears, and he went from paralysis to being able to make movement and to take the steps. One of the things that I want to point out in this situation is that it's a miracle to jump from the small fishbowl to the large fishbowl. It's possible, and we all do this, and we all are doing this. It's beautiful, it's terrifying, it's possible. And that's our first case. Our next case is of a provider who is in functional medicine practice. This was a person who is a specialty physician, not a primary care doctor. So specialty physician, there's many of us here at the conference. So you could be a subspecialist of internal medicine, you could be endocrinologist or rheumatologist, a GI, a neurophysician. Other specialty physicians that I see all the time are physical medicine rehabilitation. Also, I've worked with ENT, so specialist surgeons, psychiatry. There's lots of options here. This particular individual, a woman, was extremely knowledgeable, almost had encyclopedic knowledge of the application for functional medicine. She was practicing. She was a very impressive and brilliant practitioner. Her husband was a researcher, and they used to stay up all night long just reading literature, reviewing protocols, materials, and they just inspired so much curiosity in their children. Their children just loved to read and to learn because of how this family was set up. Her challenge was that she was starting to go way over time with her patients in the clinic. And there's a lot of reasons why we can go over time with our patients in the clinic. You know, sometimes it's because we've been in practice and our patients are getting more complex, so there's more complexity. In this case, it actually wasn't because of the patients. There was actually something happening for her internally. And we started to explore that further, because everything needs to be more individualized to understand, you know, the root of the problem. In this case, she had 60 minutes for a new patient appointment. She had 30 minutes for a follow-up. There were 5 other providers, and none of them were going over time. So we looked into this, and the first things that she started to talk to me about were, I'm getting a lot of feedback from my colleagues, and they're starting to talk to me and trying to help me, but she really didn't want to hear anything that they were saying. She was very resistant and shut down, unable to hear. She found it very difficult to make any adjustments or changes. And she said things like, you just don't understand. I just need more time. When we looked a little bit more deeply into what was happening for her, it became clear that it was a very interesting dichotomy. And this is this last piece right here, which is that even though she was one of the most knowledgeable practitioners in terms of tools and testing, interpretation, patient care, decision-making, creating a comprehensive plan, she actually was lacking some confidence in herself to be able to help patients and to do a good job and for the whole process to be working. Her trigger for her situation was that she eventually shared, I don't know if I'm enough. I'm asking a lot of money for what she felt was a lot of money for her patient appointments. She knew functional medicine technically, and she knew a lot about outcomes, and she knew that it was much more effective than a purely conventional approach, but she didn't really know if she fully believed in that this was going to work for her and her patients. She said, am I enough? And she said, I have to prove myself in every appointment. And that ended up being a key breakthrough for her to see why she was actually going way over time with each patient, because she was putting the pressure on herself to prove herself in every single case. Am I worth it? So in this case, our provider was doubting the model and also doubting herself. This was a fascinating situation. So we often, I come across this actually much more frequently than you think, or maybe you recognize this is just a very frequent issue, so you agree. There's a lot of consequences to what we call the fear of the dollar sign. So that dollar sign, it's a trigger for us, and it brings up our fears and issues. And that's an opportunity for us to work through our fears and understand ourselves and see what's right for the next step. Often when we have a fear of the dollar sign, we're not able to trust the process. We need to prove our worth. And to compensate, we'll often extend the appointment time and the amount of time for prep for the appointments. So what we did, before I get to actually our solution here, what we did is we had a conversation about how her fears and some of her internal insecurities had not gone away after she transitioned. This provider was literally panicked if she did not have enough time to prepare for her appointments. So enough time was, we're talking about spending 2 hours to prepare for a follow-up appointment time. So panic. This is some excessive anxiety. She had actually experienced frank panic. So what I did at first was I provided some encouragement, and I acknowledged where she was. And then we got to a point, and actually it was a really helpful point, which was that she really acknowledged that she felt that she was going to die and that this functional medicine was killing her because it was way too much, and it was like a life and death situation. And that panic and anxiety was literally that life experience of fear and terror. So someone actually, Linda, who is joining our practice, Linda Sherlin, who's in the front row, we were talking about this yesterday. And Wow, that's never happened before. Let's go with it. What she shared was, I think I'm going to die. And I think the appropriate response to when someone says that to you is, yes, you are going to die. You are going to die to some of these fears and some of these old ways of being. And there's a window here, and there's a threshold. And you actually can find a way where you can feel like you're enough. So what we did specifically to get her to that point, after I told her, yes, you're going to die, is we talked about, there's a few small things and there was one big thing. The small things that we did was we started to pay attention to the things that she was creating wonderful outcomes with patients. So she was acknowledging these small successes and seeing and feeling these good benefits that she was creating. We were building self-confidence like one moment at a time and gradually, incrementally. And then we did this. We oriented to the true dynamics of this new medicine, which is that our patients are coming to us, they're participating in their own healing, and they have the ability to self-heal, and we are not actually doing it. We are facilitating the relationship, and we are providing the tools and providing the insight and the inspiration for them to make changes. But what is the provider's role? Are we on the hook, and are we doing it, and are we making it happen? And the answer is, this is a new model. That breakthrough is what helped her to make the shift and to be able to be much more comfortable and able to breathe again in her practice. So that is the end of our second case. I'd like to transition to the part of our talk when we're going to talk about this grid, which is all helpful tools for you. So what we'll do is transition to the honor self part of the talk. So you'll see on the back side, and I'll just give you some organization. We're going to name challenges. First, we'll actually name what's different about this new model, and then we'll talk about what's challenging for us as providers. Then we'll go through some solutions, and we'll talk about what is the potential for us, and can we be happy and healthy and whole in this new model. So the first area, and here's the grid. Of course, I'm not expecting you to read this, which is why I gave you the handout. We don't do handouts anymore. It's very 1990. But I wanted to make sure you had something to take away. And I worked really hard on this over years. So first time I ever mentored someone was in 2002. I developed a mentoring program for pre-med students. And I've been doing a lot of mentoring, and I put a lot of energy into this. And this is up to date, and it's really for this functional medicine conference. So the first part that we're going to go over together on your handout is the first column. So we're going to start with the top left. And this part is what is different about the new patient care model. So we're going to go through that. Then we're going to go over what's hard about patient care and go to the left. And after that, we'll go into business model, and we'll go into what's different, what's hard, solutions, and the potential. So first, we are in a new model where although we achieve cure much more effectively than in the old medicine, healing is the focus. The criteria for patient success is for them to be ready and be ready to engage, and for the motivation to come from within. It's not just because they can find our office and they know our phone number. The process is what heals the patient. It's not the provider. It's not the drug. So we hear a lot about how it's not the drug, but it's also not the provider. I really want to make sure that's clear. We're asked to use new tools, new knowledge base. Let's not underestimate. This is a huge aspect of learning the new patient care. Next column is what is hard for us? What are our challenges? The field is changing so much. The exhibitor booths and what they look like this annual conference compared to what they looked like last year when we were in Florida, things change so fast. This is challenging. We have very high expectations of ourselves. Our patients have high expectations of us. And we get more challenging patients because these patients are looking for answers that they can't get in another type of medicine. Our patient contact often needs to be managed a little bit more consciously. So people will ask us different types of questions between appointments, and if they're their conventional provider. So managing that contact is really important and essential for balance for providers. We're managing relationships. We're providing comprehensive care. It can be harder to stay on time. Care is more intimate. And some patients don't embrace their role as playing a role or accepting that this process is going to take some time. Also, this is my favorite one. It's not as cool to be tense, driven, and overproductive. It was very cool in our previous model, but it's just not as cool. So now we're supposed to be relaxed, driven, and overproductive in this new model. Right? So good luck with that. We do sometimes have more control in functional medicine, more control over the model, the appointment, and we might have more time. But sometimes our own emotional patterns can actually come up and play more of a, we'll see them and perceive them and feel them more because we're actually having more control, and you can see that play out with relationships with patients and colleagues and staff. So, I have not left you there. I have given you column number 3. Column number 3 is some solutions for us. So let's go there. Solutions. Commit. Make the transition. Have 2 jobs for the least time, but be realistic about the finances. I created this grid in my practice. I have a number of colleagues, nurse practitioner, physician assistant, another physician that works with me. And I made this grid, and I shared this with one of my colleagues. And then my nurse practitioner gave me her notice. And she was establishing her own practice closer to home. She had a very long commute. And I wondered to myself, oh my goodness. I told her to have 2 jobs for the least amount of time, but be realistic. And I completely shot myself in the foot. Of course, what is best for her is best for me and my practice and our patients. Learn to manage time, expectations, yours and your patients in this new model. And even just naming that the expectations are different and working with that aspect. Of course, committing to training is very key. Finding the ways to be a mindful provider. What I will do in a few slides is I'm going to tell you what we do at my clinic. I'm going to tell you how we set up the day, what we start with at the beginning of the day, and how many patients we see at a time, when we put in documentation time. And I'm going to share literally what is the model. So you don't have to come on site to see what it is, because this is ways to build in some of this embodiment for the provider. I sometimes do a time log. That's very helpful to see how we're using our time. There's a lot of unconscious ways that we're behaving, and using a time log is a great way to see what you're actually doing with your day. Gratitude journal. I actually prefer over a gratitude journal is just to say out loud when I'm in the car all of the things that I am grateful for, to the point where I actually start to smile and laugh. It's not like a to-do where I'm writing a list. It's another job, another task. I literally just start to feel and appreciate and to name all of the good things, all of the things that I'm receiving and I'm so grateful for. Having an end-of-day ritual can also be very helpful. For example, choosing to mention the best thing that happened to you that day to your family members, as opposed to sometimes we have a pattern of talking about some of the challenges when we get home. So an end-of-day ritual, whatever that is for you. Also, I'll say body-centered awareness is extremely helpful. So I myself did a somatic therapy every week for a year before med school, every year of med school, every year of my 4-year residency, and for 1 year after my residency. So almost 10 years, I went to the same provider, and she helped me to feel and to process my experience as I went through medical training. And I'm very grateful. She's actually the person I went on to lead some self-care retreats for providers with later on, so we were colleagues eventually. And she helped me to be in my body. And it was a very dynamic relationship to have with someone. And it was a personal commitment I'm very glad that I made. Additional solution, last slide for solutions for the practice model is continuing to see symptoms as clues, not problems. I love these clues because I'm confident in my approach to understand them. Doesn't mean I know everything. Doesn't mean I'm freaked out about whether or not I can help this person, do I have the tools, and that's also why we practice and want to be in close relationship with our colleagues to get help and to talk things through and to expand and deepen our practice. Appreciating the mystery. Every person is a mystery. We are a mystery. And we're part of that. And having it be a mystery rather than a big problem that we can't solve, it's a shift. I invite you to make that shift. So what's the potential for us? The potential is for us to be in our body. It's to be emotionally healthy. It's to have boundaries and be able to say yes to our experience that we're having moment to moment. Be able to know what our needs are. And even be able to not just identify, but give ourselves what we need. Like a break, or a snack, or a change in our schedule, or maybe even a shift in our work. Like, you know what, I really am noticing that I'm attracted to and I enjoy, and I would really like to be doing this part and not so much this part. And I've seen many people shift and change their careers. What would it be like if we had space and time, enough space and time during the day? So taking a step towards that. That's why sometimes people will call me and do a phone mentoring on that. I'd like to feel that. That's my intention. I don't know where to start. What's my step? Help me. To feel kindness and tenderness, not just towards others, and not just towards, it's to feel it for oneself. So transitioning, actually this is an important piece I want to mention. Believing in an excitement about the model, but not fearing judgment and criticism as much. This is also the last potential, the slide for this area of our potential. So it is okay if my colleagues don't accept what I'm doing, because I know what I'm doing is right. It's the right thing for me to do. I believe in it. I've made the decision. I know myself, and that's enough. So there's a freedom and a permission from no longer having to fear and having that ongoing tension. It's like they just don't get me. They just don't understand. You know, it's okay that that's where they are, because I know where I am. So let's transition. So you've got your sheet. We've just gone through the new care model. Now we're going to talk about business. We're going to talk about what's different about business in functional medicine. Then we're going to talk about what's hard about business. Solutions, and the potential. And there was a kapow after not fearing judgment and criticism. Okay, so let's go back there. I want to get that kapow again. See if you listen for this. It's subtle. So we're in business. What's different? There is a dollar sign, so the currency of we're not necessarily charging for appointments, but just the idea of charging or the potential that we might start charging, there's a relationship with this dollar sign. There can be a fear of this dollar sign. So that's different. If we do charge money, or even if we don't charge money, there can be an increased expectation on us. We may need to create a business entity, a marketing funnel. I remember when someone explained to me what a marketing funnel was. I was like, oh, okay, marketing funnel. Does anyone need me to explain what a marketing funnel is? A marketing funnel is a way to understand that you're guiding people towards your clinic. You're looking for patients and you're developing steps and processes. It could be live talks and blog posts and newsletters. There's all these different aspects. And you're doing marketing so that you can funnel people towards your practice. It's called your marketing funnel. So this is important if you need to actively recruit patients. Let's say you're at a point in your practice where there's not enough referrals from the existing patients. And also you might need to think about multiple revenue streams if you're not getting all of your revenue just from your patient appointments. So that's a whole other talk, which we will not get further in depth. What's different? The dollar sign. What is hard about these differences in the business model? Am I enough? Is functional medicine enough? Will I have patients? Am I worth the money? And we're often our own boss. So I got to run the business and I got to be the clinician. That's another thing that's hard. What are some of the solutions? So I know these slides look very similar. That's why I'm kind of very actively guiding you in what stage we're at. We're actually in business in the solutions section. So what are the solutions to some of the business challenges? Number one, be in practice, transition, gain experience, see the results, and organically begin to get that confidence. And there's a lot of business practices that, we learn a lot when we're in practice. Know your value, own your good results, and take credit for those. Practice healthy self-promotion. I was in the elevator this conference, and does everyone know about Integrated Connects? This is the website to post a job position or be able to find a job if you need to. Does anyone know what Integrated Connects? So if you've heard of that, could you raise your hand? Okay. And if you haven't heard of Integrated Connects, could you raise your hand? Okay. There's more people in this room that have not heard about Lisa McDonald, Integrated Connects, who has devoted years of her life to create this website, and it's where you post the job and find the job. And she has a table, and it's in the main area between, it's actually right outside here, and she's been sitting here for 2.5 days. So one thing that we're not that good at as providers, and something Lisa and I were talking about in the elevator, is healthy self-promotion. So James Maskell, there's other people who've had like these free interviews, and there's opportunities to promote, and sometimes we don't see them, we don't remember to emphasize those, but I want to encourage us to learn how to find ways to do that healthy self-promotion and to promote each other. That's a great way to deal with it if you are uncomfortable. Is that you get a partner and you promote the partner and the partner promotes you, and you can even do it in the same session. And it's a great way to break through that, and you feel that freedom to say, you guys really need to know about Lisa McDonald in the Integrated Connects. And it's integratedconnects.com. And you want to find a position, go there. And this is a way to open up our opportunities for each other and know about this great resource. So I will invite you to choose that if you're working on healthy self-promotion and getting better at it. We're creating our support structures, our staff, office space. We're learning about regulations, all of our insurances, malpractice, slip and fall, workers' comp. There's a lot of stuff happening here, so sometimes we need help. And we have some help. Dan Kalish he has a wonderful organization that's closely affiliated with IFM to help with some of these logistics for creating our practice. And we've helped many providers as well. The potential in this new business model is to know our value, to know that we're worth it, and that we can actually have the right amount of work and it could work for us financially. That is the potential. So that has to do with whether or not we're comfortable with charging money, if we're charging money, and if we're not, are we in a model that works and is sustainable? So there's the potential for us to have the right amount of work, and also as part of that to have a healthy relationship with time. That's another topic people will often bring up in phone mentoring is, I am racing against time all day long. I'm never winning. And I want to change it so I'm not under the gun all the time. Can you help me? I feel like I'm rushing from one thing to another and I'm not living. The opportunity is that healthy relationship with time and also a well-run medical clinic or system. And that's a process. So I'd like to finish up this section on this grid, on this overall framework. And I'd like to also share that we are actually hiring, if anyone would like to consider coming to work at our clinic. I'm going to exercise healthy self-promotion and say we would love to invite your application. So we're west of Philadelphia. And we're looking for a provider to join us. We're really excited about that idea of that new energy and that new person seeing themselves as someone who could be a colleague and be part of our loving work environment. I'd like to tell you a little bit about our work environment, because what we do as a team in Philadelphia Integrative Medicine, and this is what you do in your own clinic, you make your clinic your own. You do it your own way. So this is my clinic, and what we do in my clinic is we meditate as an office, the admin staff and the providers. We meditate for 10 minutes in the morning together. We have time for the providers to do their patient messaging and patient prep for the day, and then we have a half-hour provider discussion together about patient cases for the day. Then providers go to their patients and they see 2 or 3 people at a time, and then they have time in the schedule to document those patients. And they have a break. And then they go back to patient care for 2 or 3 patients at a time, and they have time in the schedule to document and take a break. So that you don't have that accumulation of patient charting and documentation that feels like that heavy burden by the end of the day, where we feel like I've done my patient care and I feel really good about the way that I've managed things and responded all day long, and now I have this big beast, and I don't know how much time it's going to take me, and I'm tired, and I'm hungry, and now I've got to do all this documentation. So our providers leave before 5 o'clock, and they have everything done, and they can go home, and they can have a life and have work-life balance. And we've figured out how to set that up. And we also have great support staff. So, if you want to come over to Philly for a little heaven on earth, maybe you guys will apply. I'm hoping one of you out there might be next provider. I have a little advertisement. It's over there on the corner if you're interested. We have made it to the latter part of this session where we are going to do our self-assessment. So we have made it all the way through to the sunset, and I'd invite you to take your pieces of paper out, grab a pen, and I'll just give you a minute or two to review for yourself the answers to these questions. So this is the document. It's this side. It says Honor Self-Assessment. So does anyone need a little bit more time to finish that assessment? If you need more time, please raise your hand. Okay. So just want to give us the chimes. So we're transitioning to live response. So this is when you're going to need your phone and you're going to need to log in. And Marty has helped us to explain how we can register our responses. We're not going to do every question, but I'll tell you which questions we're going to do.
This is in the same part of your IFM program app where you submit questions. There's a separate section called polling, and you just click on that section and you can answer these questions live. So this is just an online audience response system.
Okay. So great. You guys are already doing it. I'm so excited. I want to be able to see. First question. So keep in mind, we're skipping a few. So we didn't start with, I have loving relationships. And we didn't start with, I see my role in creating my life I can change. We skipped right to the third question, which is, I see how to relax and I do it daily. So thank you so much. Okay, so take a look and see where you fit. The next question is, I make time to eat. So if you can respond to that particular question. Okay, this is very helpful. So this is not what we eat. This is not vegetables. This is not counting, right? This is, I actually am making time to eat. And 15% of us are stuck in this area. And this is absolutely normal for the clinician talks that I give. So this is a big deal. Okay? We're doing great. Okay? Next question, please. The question we're answering, so it's not the next one in line, we skipped one. It's I exercise on a daily basis. So if you can just respond to that. Wow, interesting. Okay, so a little over 50% of us are stuck. It's good to be stuck together. Next slide, please. I sleep enough, and it's good sleep. So we skipped one. We're going to I sleep enough, and it's good sleep. So over half of us are doing okay. 20% of us are there. About a quarter of us are stuck. So that's good for you to know that you're not alone. And that's also a great thing to discuss with your colleagues, and it's also with phone mentoring. Okay? And let's go to the next slide, please. The next one is, I have fun, I laugh, I smile. Yes! Oh. Okay, so 15% of us are working with that, are stuck with, I have fun, I laugh, I smile. 60% of us are doing okay, and a quarter of us are, I'm there, it's great. Next slide, please. I love this question. The question is, I respond to my body's needs, and my body feels healthy. So about a third of us, or a little bit over a third, are stuck. Over 50% are doing okay, and under 10% are there with responding to our body's needs, and our body feels healthy. The last question that we'll do audience response is, next one please, is my body has time and interest in sexuality. So this group is actually doing much better than most of the other clinician groups I work with. Unless you're just playing and teasing me a little bit here. But this is actually way better. So the answer to the question is, over half of us are stuck in having time and interest in sexuality. 37% are doing okay. That is phenomenal. And about 8% of us are, I'm there, it's great. So thank you for participating in that. What I'd like you to do is just find your elbow partner, and we'll just do a brief interactive exercise before we go to Q&A. Just find your elbow partner, someone who's sitting right next to you. Introduce yourself, even if you know them already. And what I'd like you to do is I'd like you to do two things. So two things. There's going to be a partner A and a partner B. So the two things that partner A is going to do is, number one, choose one thing on the list. One thing. And then share with your partner if you know your next step. So when you're ready, partner A can start. And partner B, you are just listening. No advice, just listening. You're going to have just about a minute or so. So partner A, you have 10 seconds left. And please thank your partner. Partner A is finishing, and now partner B is starting. Partner A, just listen. So you're transitioning and switching roles. Switch over. you have a few seconds left, partner B, and then you're getting ready to finish up. So finishing up. Thank you so much. Everyone, please thank your partner. So thank you very much. We're getting ready to finish the presentation, and Marty's got a very important job to do. She's got questions for us. Before we finish, I'd just like to share that there are 2 ways that I renew myself. I'll just very briefly share those with you. And then you can see that this is where we've come and gone, so I won't go through the summary slide again for time and maximize the amount of time we have for questions. I'd like to share a prayer that was inspired by a friend of mine. I actually have her cards outside. Her name is Rebecca Cohen, and she's created her own modality called the Path to Heal. And she's a business coach, and she's my business coach. She's one of the many coaches that I have. And her work is here on this card. And she helped to inspire 2 prayers that I use quite frequently. The first one is something that I read every day. And it goes, I am an unlimited divine human. I exist on an infinite plane of time and space. I have expansive time and space around me as my scientific soul discovers the easy solutions to heal human disease. And the other prayer, which is very brief, is also something I worked with Becky. I release areas of physical and emotional pain, and I can manifest what I want almost seamlessly. I ascend into radiant pure joy while staying completely grounded. I integrate feelings and emotions I haven't made space for. This allows my clear and focused mind and a healthy body because I'm no longer working so hard to hide unpleasantries from myself. I am aligned with, I am worthy of peace, love, and happiness. So thank you so much.
So much wonderful food for thought. So we just have time for just a couple of brief questions. And this kind of would dovetail with what you just shared with us. What are some small and truly realistic things we can do throughout a crazy workday to help ameliorate the buildup of stress?
Okay. I would suggest that we remember our breath. And that doesn't take any time at all. Just taking a breath right now. And breathing in and also making sure we exhale. Oftentimes we just stop after we remember to inhale. And we use our breath. There's wonderful ways, and I teach a lot about breathing to help clinicians to work with anxiety, because there's L-theanine, ashwagandha, and cortisol manager, allergen-free, and there's a lot of stuff we know about supplements. But let's use our body and our breathing as a tool to come back into our body and to be with these moments.
And this would probably dovetail well with the sexuality question. How do you help folks balance the I shoulds of self-care activities and motivate change instead of creating more guilt about what they are not doing?
Love this. All we ever do is feel like self-care is all these things that we should be doing that we're not doing. So I just invite you to really make that shift. So we have so many weapons we use against ourselves. So remember today, remember this conference, and remember yourself, and let's not go and walk forward in shame. Let's walk forward in partnership with ourselves, and if we need help to take a step, let's reach out and work together.
That's wonderful. So let's take care of ourselves. Let's take better care of ourselves. Thank you so much again, Dr. Tetlow. This has been wonderful.